Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, how are you? How are you today? Thank you so much to tune in into Back into Alignment podcast every Friday. We are bringing healthcare professionals that bring and shed light into our life, especially if you are suffering of a particular spinal dysfunction, like scoliosis, like spine bifida, perhaps you have stenosis or osteoarthritis. You know, there's so many pathologies and also issues related to the spine because the way as we are living lately it has been moving us into being actually static. I am excited today to be with a physiotherapist from the city of Wealth, and his name is Dave Ross. This is his second episode with us. The first episode we had the opportunity to know how he started his passion to be a physiotherapist, kinesiologist, and also a facilitator of education for those that are interested to learn more about spinal health. Today, we are going to dive deep into a new topic, which is very close to me because I actually was diagnosed with osteoarthritis 2 months ago, which brought me into a new world of learning what this happened to me and what it is, right? So I'm excited to talk about this with Dave Ross. How are you today, Dave? Thank you so much for coming today.
I'm good. Yeah, thanks for having me back. How are you?
Yes, excited to get to learn about osteoarthritis from you because I know you actually give a lot of support to the elders in your community related to osteoarthritis. I'm not so old, I'm actually 37, but one every 5 women before 40 suffer of osteoarthritis, which is something that I didn't even believe until I actually part of these statistics. So Dave, first of all, how was your week and how are you preparing for your low back webinar that is coming up?
Yeah, my week's been busy. The preparation's going well. Just putting together the slideshow for the presentation, putting some finishing touches on it, but it's coming along. So hopefully it'll be educational and fun for everybody.
Super. For those that are tuning in for the first time in our podcast, Dave is a physiotherapist that is graduated from the Queen's and McMaster universities. He has dived deep into acupuncture, vestibular rehabilitation, concussion, and a lot of manual therapy, which he applies on his patients. He also teaches courses related to this approach of rehabilitation, and he spends some time when he can volunteering in places of low advantage communities like Kenya, Haiti, Uganda, El Salvador, and he is a father of 2 young kids that keep him pretty busy doing sports outside. He just commented he just got a beautiful home close to the woods, so he explored nature with his 2 kids. Yes, awesome.
Thank you for the intro.
Yes, and first, before we go dive deep into osteoarthritis and all the causes and the treatments, we wanted to invite you to be part of a free webinar that Dave Ross is bringing into the community. It's called Fix Your Back Pain, 5 Steps to Eliminate Back Pain. Very interesting. He's going to bring this on September 21st at 7 p.m. to anyone, anywhere. Awesome. Okay, so let's go and actually remember our last talk was about the spine and obesity. Very important correlation between these two. When you gain weight and you actually struggle with obesity or just overweight, this will actually impact your joints and will increase your back pain. Can you please remind us about what's happening with the pandemic and how do you see this issue coming in an incremental level now?
Yeah, I'm seeing a lot of people come in reporting back pain and simultaneously reporting that they have put on anywhere from 20 pounds to I think the heaviest I've seen is 65 pounds now of weight. It's a lot of weight to just add that on in a very short period of time. And to have that around your midriff in particular, if you're somebody who gets a lot of belly fat, it's hard on your back. It pulls the whole spine forwards, and then puts extra pressure on the discs and extra pressure on the joints at the back of the spine. And then that can, wear them away faster because now there's more weight rubbing more frequently, and can lead to osteoarthritis, but also just cause the muscles to work harder and cause more strain in the muscles and pain that way as well.
This could also be affected because the pregnant woman, right? Pregnant woman can also experience a lot of back pain. So for those women listening to this conversation, you can come actually down. And about 2-3 years ago, I interviewed a pelvic floor physiotherapist. She was really interested in understanding the woman's body changing with body weight incremental. So she actually has many topics talking about the back pain related to the pregnancy. And also last year, I interviewed another doctor talking about the breastfeeding and how this actually affects the shoulders of the pregnant woman. So please come back into the episodes of last year and 2 years ago so you can actually get to listen to this for a woman especially. Now, as we were reading about the stats related to the spinal health, we actually know that the low back pain is one of the most prevalent conditions in the United States and in Canada too. It is the second most common reason for visits to a physician, and is the leading cause of absence from work. So I understand when you take those days off, perhaps it's because your spine is not in a proper position. Even when you go to work, you may not be able to perform with proper accuracy or focus because the neck pain is always there pinching you, or your lower back pain is keeping you distracted, out of focus and concentration. So talking about obesity and lower back pain is also widely prevalent and expensive. It's expensive. We're talking about 90 billion and a cost of 118 billion. So basically the annual cost is 90 billion and a total cost of 118 billion. This is actually the cost of actually having low back pain and obesity. It has been estimated that the worldwide prevalence of men with a body mass index greater than 25 increased from 28.8 in 1980 to 36.9 in 2013. Now, how are the numbers in this year, 2022? We don't even imagine if from 1980 to 2013 increased almost 10%. Now, I can't wait to find the numbers because this was actually a study that was done on 2020. So I'm wondering how is now? And we don't need much of examples because we see this on the streets. We can see this. There is a lot of issue with weight management. Now, something that we wanted today to actually bring some awareness is about osteoarthritis. Osteoarthritis as a degeneration issue of the bone and the joints. I wanted to bring Dave to actually share with us his experience with the elders and even with women, as we know women experience more osteoarthritis than men. So please tell us a little bit more about your community. What do you see normally in your clinic?
Yeah, so we see a whole variety of ways that this presents, whether it's osteoarthritis in the knee or hip, or degenerative changes in the spine, whether that be in the joints or in the disc. So it presents in all sorts of ways, if that kind of is a broad way of answering your question. But more specifically, if the joint itself is degenerated or worn away, if you think about the way a healthy joint, the way a child's joint is, if you think of a piano key and you can kind of, how smooth a piano key is, you touch it and it just feels perfectly flat. That's what a good healthy joint should feel like, nice and smooth, no issues. As we age and as osteoarthritis or just wear and tear of the joint sets in, what happens is it goes from being nice and flat and smooth to being more like a gravel road or a gravel walking path. It's got ruts and divots in it, and it's not smooth. And that's why sometimes you hear that kind of the grinding, the cracking that happens, because now the bone surface, the way they come together isn't smooth, it's grinding against each other. So when that happens, you get inflammation in the joint, which any inflammatory factors will always cause pain because the nerves in the joint are receptive to the inflammation, and then that signals the brain to have a pain. Then also the muscles around the area, they'll try to protect it and try to help it out, and then they'll kind of turn tight and irritated, and then they'll also cause pain because they're being overused or worked in a way that they're not used to working.
Mm-hmm. We are talking today about osteoarthritis, but we're getting questions about rheumatoid arthritis. So
Okay.
can you please tell us the difference between rheumatoid arthritis or RA and osteoarthritis or OA?
Sure. So the end result is fairly similar in that the joint wears away, and over time, like I was talking about, those two joint surfaces, they're supposed to be nice and smooth. They end up kind of grinding together. The root cause of that is different, though, and that's osteoarthritis. It's a wear and tear over time, a breakdown of those joints, whereas the rheumatoid arthritis is actually the body thinking that those joints are actually a foreign invader, shall we call it? And so
Mm-hmm.
your immune system is actually attacking the joint surface of the person. And so
Yes.
that typically we see that in the hands, the wrists, the feet, and the ankles, the joints that do the most work. But somebody with severe rheumatoid arthritis, it can be in the knees, the hips, the spine, less so in the elbows, and sometimes in the shoulders.
Mm-hmm. And you receive mostly women in your clinic?
No, I would say it's probably so. I guess yes, there's more women than men that come because women are better at seeking help for their health than men are, and I say that as a man.
Mm-hmm. Mm-hmm.
But yeah, statistically, we do see more women than men, but it's getting better. I notice kind of year over year, there's less of a stigma associated with seeking help to, when you are injured, that you don't just have to walk it off if you're a tough guy. You can go and get help and get better quicker. So we're seeing some of the guys who are the farmers outside of Guelph here, they're actually coming into town to get help, and it's great to see, especially for the osteoarthritis they have in their knees and hips. We have a whole program for knee and hip osteoarthritis, and it's been really successful, particularly for those gentlemen, but as well as for the women that still make up the bulk of the numbers.
Mm-hmm. Well, we're talking about 6 million of Canadians with arthritis. 6 million. And I believe the projection goes to 9 million by 2040. These are actually statistics from the Arthritis Society right here in Canada. I actually went yesterday to the office to meet to the contributors. I really love what they're doing. They are bringing information about cannabinoids and the effects of cannabinoids to release this inflammation. Particularly, I started with one treatment, and I'm actually testing and see how my body is reacting to this. Now that you're telling us that you bring a particular group of only osteoarthritis in your clinic, can you please tell us about your approach? If it's more educational for lifestyle, or if you are actually using some pharmaceutical support into this program?
Sure, yeah. So the particular program I was referring to is just for knee and hip osteoarthritis, and it's a program called the GLAD program. It was initially developed in Denmark. And don't ask me what the G and the L stand for in GLAD, but anyways, so you can look up GLAD Canada on the web, and there's clinics all over Ontario that offer this program. And you have to be certified to run the program. So we have a couple of therapists in our clinic that do that. And the results are really staggering. So what they did was, in Denmark, they had this crisis of, with the aging population, the baby boomers are kind of aging out. They all need hips and knee replacements because of the osteoarthritis. That's kind of, I think a word you used was epidemic.
Mm-hmm.
And so they don't have enough surgeons and enough, operating room time in order to treat all these people. So they looked at, okay, if we can't give them knee and hip replacements right away, what are we going to do for these people? Because we have to help them somehow. And so they looked at the research and they developed this great exercise program that in some people can completely prevent needing a hip or knee replacement, but in other people, it can delay it by 5-6 years. And it's a very affordable option. There is no pharmaceuticals, to go back to your original question. It is purely exercise and education based. So it really starts with learning how do you get out of a chair without hurting your knees and your hips? How do you go up a flight of stairs without hurting your hips and your knees? Because these are things we take for granted that we do from when we're very little, but there's actually ways to do it right and ways to do it wrong. And if you can learn just some of those simple movements and then strengthen the muscles in the knees, the hips, well, the whole body really, you can help significantly reduce the pain, or in some cases, temporarily alleviate it.
Mm-hmm. Yes. Well, as you were saying, as a nation, we are experiencing an under-recognized public health crisis. The epidemic of the osteoarthritis is definitely getting to many people. We're talking about 6 million. There's a lot of people around. In Canada, we're talking about 32 million in America. So this is like perhaps a global epidemic. And I actually didn't know, my mom actually has osteoarthritis. And many of my friends, they're young and they now, I'm so curious. That's why it's so important to see pain as a teacher. We're always learning from pain. As you were talking about this program that has been bringing awareness about lifestyle as a way of healing, the average cost to treat a year osteoarthritis can go up to $2,000 a year per person. So do we have an affordable alternative solutions instead of prescription drugs? As you were telling us about this lifestyle where you actually become aware of your posture, what does it include this program? Is it like a particular break of behavioral patterns? Like what type of psychology do you actually use for people to start implementing these habits on daily basis?
So I'll start by saying I don't run the program. So I although I'm familiar with it and I've seen the program run, I don't know all of the ins and outs with it. I'm not actually trained in it. But I'll do my best to answer your question. So it's not so much psychological training as much as movement retraining. So movement patterns. So you're a personal trainer, so you would know that, you can do a squat properly that will be good for your back and good for your knees and your hips, or you can use really bad form and you can injure all of those joints simultaneously, especially if you're putting too much weight through them. And so it's the same kind of idea, is learning how to do the things that we take for granted, that are daily activities: walking, stair climbing, getting in and out of chairs. Getting in and out of the car is actually a really big one that people, particularly with hip arthritis, struggle with. Yeah, just learning these little tips and tricks to do them and then practicing them, so that the program's actually twice a week. It runs for I think 8 weeks total. So it's over a 2-month period, and it just, they start with a little bit of education and then they build on it and build on it and build on it.
Mm-hmm. Is this online or in person?
It's in person.
Okay.
Yeah. And I believe that there are some places that do run it virtually, but I love virtual, and there's a lot you can do, but when you're trying to assess movement patterns, there's just, a one-dimensional screen just really can't give you that three-dimensional view that sometimes needs to be corrected in terms of helping. So, I mean, if you can't get out of your home, the virtual version is better, or the virtual version is an option, but I would always encourage people to do it in person. The other nice thing about it is a group program, and so you can learn a lot from other people while you're going through it. And I think there's value in community, right? You realize you're not suffering alone. There's other people who are going through the same thing that you are at the same time. Some people are a little worse, some people are a little better. And so having that community is also quite helpful.
Mm-hmm. Okay, so it's all about creating a community, bringing awareness of posture and how to move in a functional way. Yeah. And what about that approach about the pharmacological treatments? And sure. Are you actually also bringing this into the program?
So yeah, there's no pharmaceutical component. As physiotherapists, we can't prescribe drugs or medication. I suppose, one of our clinics does have sport medicine doctors, and, we can send people that way if we feel that they really need something. But, to go back to what you had said, it's $2,000 a year for pharmaceuticals. And when you break that down over a month, it's less than $200 a month, which is not a huge dollar amount. And I think the reason, and this is my personal opinion, I don't have any research to back this up, but I think one of the reasons people, default to the pharmaceutical approach is because it's actually not that expensive at less than $200 a month. And sorry, that was my computer buzzing there. It's not that expensive, and it's easy, right? It's easy to pop a pill. It doesn't require any work other than just remembering to take it. And so I think there's a certain element of how easy and readily accessible and kind of programmed we've become to take those approaches. But to go back to your original question, we've talked about exercise. Obviously, diet plays a big role in it. There's foods that are great anti-inflammatory foods: tomatoes, olive oil, green leafy vegetables, nuts, things like that. There's also foods that are bad and cause inflammation, soda, French fries, refined carbohydrates, red meat. I always tell people everything in moderation is fine, but if you're having a can of pop every day, that is not good for any part of you, right? So, you can balance those things out. There are other options in terms of injectables, such as Durolene or Synvisc. Those increase the viscosity of the joint where the arthritis is. So I kind of equate it to like doing an oil change on your car. So naturally inside of our joints, there isn't blood, there's actually this synovial fluid. And it kind of acts like an oil to grease up the joint. And as we age, it can kind of decrease in there. And so pharmaceutical companies have actually created an alternative version of this that is natural, and you can inject it in, and people have great results with it. Not everybody has great results, but having that extra bit of viscosity in the joint allows it to move freer, and if it is grinding, it kind of just gives it a little buffer so that it'll move smoother on itself.
Mm-hmm. Okay, so you focus more on the non-pharmacological treatments.
Correct.
That include interventions including exercising, weight loss, and self-management by becoming aware. So that's actually the approach that you're doing, which at the end is not a band-aid. It's actually a lifestyle that requires discipline and practice. Awesome. Yes, great. For those that are listening to the podcast up to now, I can invite you to my 30-day hip healing program, which is basically daily practice of 10 minutes. So I tell my clients, if you can commit for 10 minutes to release the tension on your hips, then this program is for you. Only 10 minutes, of course. If you like it and you want to add 5 more minutes, and maybe perhaps you want to do for the 30 minutes, then great. The more time, less than 30 minutes is enough to actually get the hips moving. The program includes stretches from the office on the sitting position to be on the yoga mat when you have a chance to lay down with comfortable clothes. So if you want to join this 30-day hip healing commitment, please send me the word hip healing and I will send it to you. I will send you the information of what requires to do this. And it's like you're saying, it's all about pain management and becoming aware of the posture. As I was going with the numbers of what's affecting the issue, the main issue with osteoarthritis is it's a constant pain. That's what I actually can describe it. It's a constant pain. And it can really affect the performance at work. We're talking about 80 billion of money lost because lost work days. We're talking about people are taking emergency days or sick days. They are using all the health benefits. Mostly $500 goes really fast. We're talking about $2,000 expense. So at least we know that it's about behavioral change. It's about our habits. And also to have support, very important, with proper professional support like Dave that is in Wealth. So Wealth, now as we are finishing our call, Dave, can you please bring perhaps only 3 tips for those people that are experiencing for the first time osteoarthritis? Like what should we do when we are feeling pain because of osteoarthritis? What is the top 3 changes that we must do?
Okay, and we're talking about lifestyle changes, correct?
As a physiotherapist,
yeah, okay.
Following your approach, yes.
the reason I wanted to clarify that is just because, anti-inflammatories and pharmacological treatment does have its place in amongst this. So, I don't want to totally dump on that because there is reason why those medications are prescribed. But if we're talking lifestyle, as I mentioned, changing your diet can make a big difference, particularly around cutting out those refined sugars and really focusing on getting good, healthy vegetables. So that would be one thing. You don't have to completely scrap your diet in one day, but maybe you just change one meal or you change a few things, like you were just talking about with the hip exercises. 10 minutes a day, little changes, they add up over time to be big results. Trying to do everything at once, usually you just end up failing and getting upset with yourself. So really important to make small little tweaks. So then I would say exercise, whether it's a program like you have where it's 10 minutes a day, or whether it's going for a walk, depending if walking is difficult, or you just have to get moving. Motion is lotion, I think you said was your favorite phrase at the last podcast. And I like to say, use it or lose it. It's the way our bodies work. If we're not moving and exercising, you're just going to feel terrible. And then there's so many other benefits of exercising too, right? Cardiovascular health, making your lungs and your heart stronger. So that was 2. And then I guess the third thing is get community. It's really important to have at least one other person, whether it's your spouse or partner, whether it's, a brother, sister, friend, whatever, having somebody to do that exercise with you, or a coach or a trainer to walk you through it so that you're not hurting yourself, you're not biting off more than you can chew. Obviously I'm a physiotherapist, so I'll advocate for myself a little bit too. If you're in a lot of pain, you need to deal with that so that it's not setting you back from what you want to do. So, get the help that you need in order to be successful. Don't just try and go it alone, because that's usually a recipe for disaster.
Totally. We learn so much when we are actually in a community, because we know that what we feel, our next neighbor is feeling it. So we're not alone in the journey of healing. That's why I got connected to associations related to osteoarthritis. So instead of feeling depressed, which is also associated with lower back pain, I'm actually trying to shed light into the journey of healing. And thank you so much. I learned so much from you always. And sending me all those articles that you have proper, reputable sources. I get the statistics that open my eyes. And especially with the expenses, there is so much money engaging on this. Like, there's so much money that we do have to compromise. So let's start taking care of our lifestyle by taking in action the 3 tips that Dave just commented. To move, motion is lotion. To be following a proper treatment with a lifestyle and nutrition, and to be part of a community that you feel connected to. So Dave, I'm excited to continue with our 3rd episode next week. And if you want to know more about Dave Ross, he actually has social media. You can follow him on Instagram. You can find all his social media handles on the show notes. And please sign up to his webinar that is coming up. Fix Your Back Pain, 5 Steps to Eliminate Back Pain. How can you find this link? It's literally in the show notes. It's on Eventbrite. You can just register at 7 p.m. on September 21st, and you can get to ask questions. Can we ask you questions in the webinar?
Yeah, absolutely.
Great. Yeah, so you have a one-on-one personal consultation with Dave on that day.
I don't know about one-on-one. We've got 30 people signed up so far.
Right, exactly. Yeah. Let's do group, let's learn in a group setting.
Yeah, absolutely.
Awesome. Well, I love your background, Dream, and I really see that forest. Is that a picture, or is that real?
No, that's real. That's
wow.
my side yard. Yeah.
So you see deers there?
Yep. Yeah.
Well, yeah, I can see. You say forest, but I can now see that looks like a picture. I thought it was a picture. No, beautiful. No. It must feel so good to breathe in that forest.
It does. Yeah. It's a wonderful place to live. And I'm only 10 minutes away from work. That's the thing that blows my mind. Every time I come home, I feel like I'm at the cottage. But
Yeah,
yeah.
that's the way. I love that life. Well, thank you so much, Dave. Enjoy the weekend. This weekend is the World Wellness Weekend, by the way. Tomorrow on Saturday and Sunday, we have 3 days of celebration of wellness. So you are always welcome to join us. We are celebrating in 139 countries, including Canada. So there are going to be webinars like the one that Dave is teaching us, and they're going to be like one-on-one meetings all over the world. So please join the World Wellness Weekend by signing up into the events. I have a couple of events in my social media. You will be able to see them. So thank you so much. Enjoy the rest of the weekend, and I can't wait to see you next week.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.